It's now my honor to introduce our next speaker, Marisa Eisenberg. Dr. Eisenberg is an associate professor of epidemiology in our School of Public Health, associate professor of mathematics, and associate professor and acting director of complex systems in our College of Literature, Science, and the Arts. Her research blends mathematics, statistics, and epidemiology to understand transmission dynamics, inform optimal intervention strategies, and improve forecasting. Dr. Eisenberg has been advising Governor Whitmer and the Michigan Department of Health and Human Services during the current COVID-19 pandemic. She's also part of the team that's been advising the University of Michigan leadership in tackling the challenges of the pandemic that's have brought to the campus. Personally, I want to thank Marisa for her patience with me working through the models and adapting them as we notice new aspects of the pandemic in a practical sense across our campus. So it's really been a pleasure working together with Marisa. I thank her for all of her contributions already and turn the floor over to her for what I'm sure will be an interesting talk. Hi, Marisa.
Hi, thank you so much. That's really wonderful. Yeah. Yeah, and I just thank you also. I think it's just, I never would have expected that I would be in a situation where we're in a pandemic and models are at such a spotlight as you know they are now. It's a strange place to be, but I think we've all learned a lot, so that's good. But yeah, so let's see. Let me share my screen here. Oh, you know what? I think I probably have to do this as share my whole screen, don't I? Let's try it this way. Okay. Come on. There we go. Can you all see that okay?
Yep.
Great. Great. Okay. So yeah, so today I wanted to talk a little bit about transmission modeling and really sort of focusing on the campus context piece. That's the focus of this session. But I thought I would start by just sort of noting how the pandemic has really led to this greatly expanded need for and spotlight on modeling as informing decision making. And we can see that at every scale from, you know, I mean, President Schlissel was just describing, you know, how modelers have had an impact at the scales from campus to national and international. And we heard this morning from folks who have been informing response efforts, you know, all around the globe. And so I think like I've been one of the sort of silver linings that I've really had or sort of seen in this whole pandemic process has been watching how faculty, staff, and students have really come together to contribute to this enormous range of work in modeling and analysis of COVID-19. And this sort of interdisciplinary effort, you know, I think has just been really remarkable and has come together in this kind of rapid, organic way in the face of a really horrible challenge. And so I feel like it's neat to see in a way. And so, you know, that ranges from, you know, we heard from Brahmar Mukherjee this morning on her work modeling COVID transmission in India. We've heard a little bit, and we're going to hear some more about how you know, fluid dynamics and modeling can inform bus safety and public transportation, and it even permeates into our educational mission. We'll hear some more about this from Luis Zaman in a minute, but also I wanted to highlight Scott Page over in Ross, you know, and Complex Systems has done this really neat thing where he's incorporated sort of ensembles and thinking about multiple different models and comparing models as part of his coursework and teaching. And so, you know, I think it's been really neat to see the range of modeling methods from statistical models to machine learning to mechanistic models. And that can mean everything from game theory to networks, you know, all kinds of different approaches that people have sort of brought to bear on this challenge. And I tried to count out how many schools and colleges across campus have contributed to COVID-19 modeling work. And I found 11 schools and colleges, which not the full 19, although very possibly it actually makes the whole set. I'm not sure, but I only did a little bit of quick Googling. But, you know, it's really been across the whole campus that this has been happening. And, you know, the goals of all of these modeling efforts range from, educational things to informing intervention policy, planning for logistics, predictions, patterns, understanding disparities, improving treatments, and so much more. So I just wanted to kind of highlight that before I kind of got started on the work for today. And then I also want to, now transitioning into sort of the focus of the talk from my end, I wanted to start with a quick thank you to the team. This is a small chunk of the whole gang. Emily Martin in particular, who is moderating today, but there's a great group who's been working on a ton of different things, and a lot of the work that you're going to see comes from a big group. So just to give a little bit of background, I sort of started thinking about modeling COVID-19 stuff sort of early on, working with Emily Martin and Josh Petrie and Sandro Cinti, thinking about really sort of, it started actually with the sort of campus context, thinking about, the hospital system and Michigan medicine, and what kinds of resources they might need to stand up. But it rapidly sort of turned into more of a focus that I had. So we'd been doing a lot of work with MDHHS and the governor's office, and doing, as Andrew presented this morning, a lot of sort of regional projections and forecasting projections for Michigan and for different counties within and regions within Michigan, thinking about metrics that we can use for re-engagement, all of that kind of thing. And so then, so doing a lot of sort of social distancing modeling, that kind of stuff. And then towards the end of the summer and into the, particularly the beginning of this past fall, it really became, we sort of shifted, and we're doing a lot of work for thinking about and sort of the campus context. And so I wanted to kind of start off by talking a little bit about what are some of the distinct features that really need to be considered when you're looking at a model for a campus context. And so one of the biggest ones, of course, moving from the kinds of sort of larger scale, Michigan-wide, sort of bigger models that we had been working with, where it's a much smaller population, and it also has a very distinct population structure, right? So there's these distinct groups that you really need to be thinking about. So students, and that really breaks down into, residential, students in residence halls versus off-campus students. And you can think about that in terms of grad students and undergraduates and all these different kinds of groups. But so the student complexity, and then there's faculty and staff, and of course the broader community. And so with this smaller population, there's a lot of things that might matter that maybe could be averaged out when we're thinking about these sort of other larger models that we had been working with. And so stochasticity, randomness, network structure, a lot of these kinds of things matter when we're trying to answer questions like how much community spread might we see from students or not, or all of those kinds of different things. The other big sort of challenge or thing that needed to be wrangled with when we were sort of starting to build these models for a campus context was the lack of data for parameter estimation. So, a lot of the work that I do in terms of infectious disease modeling more generally beyond COVID too, involves estimating parameters from data, usually time series data on infection patterns in the population of interest. And in this case, the population structure was changing because, everyone was going home and staying home, and fall hadn't started yet. And so, or it was just getting rolling. And so, there wasn't necessarily this data that we would normally sort of use for estimating parameters. In this case, we really needed to start to think instead about what kinds of qualitative or other kind, how can we sort of explore the uncertainty in the parameter, sort of regime, given that we sort of didn't at the time have a lot of data on how much transmission there was going to be in these different groups, all of those kinds of things. So we were sort of looking, it's a different way of sort of using a model to understand the way that the dynamics of the model can inform what's going on. Okay, so some of the sort of questions I'm going to talk about today. So 3 questions of interest in this area. So one is residence hall density. So how much to de-densify our residence halls was a big question that we and many other people were thinking about. And this has a lot of details, that we won't probably have time for today, but what about roommates? Do you have them or not? What about dining halls? How do you do those? Lots of different kinds of questions when you start to get at this residence hall density question. Testing is also a huge piece of what we've all been thinking about, and there's a lot of questions as to what are the sort of key features that you need in order to have a successful campus testing strategy. And then the last thing I'll talk about is vaccinations, and a little bit about fall 2021 and kind of thinking about those kinds of things. So I wanted to just sort of start with the sort of overall model backbone. This is one of several that we explored. We've done a lot of kind of testing of different model structures, and looking at how increasing or decreasing complexity affects our results and that kind of thing. So in this model, it's sort of a variation of the classic SIR. So you have susceptible individuals. They move in, once they become infected, they become latently infected. Eventually, they may be infectious, so they can transmit, but maybe asymptomatic, and then they could potentially be mild or severe, and then either seek care, so in which case they would get tested or not, and so, or be hospitalized, and then either recover or potentially die. And so this is sort of the backbone of the disease, natural history, sort of the progression of the disease that we were capturing in some of our models. And I think Andrew kind of pointed this out earlier today too. You could probably get away with something quite a bit simpler, and we have done others that are more sort of simple SEIR style. You can kind of do a lot of different flavors of this, and I think it's important to try lots of different versions so that you can make sure that your results are robust to different underlying levels of detail, as sort of Jim mentioned earlier with the inference robustness discussion. So the other piece of this that's kind of key for thinking about a campus model is the population structure, right? So here we broke the population into 4 basic groups. So we had residential students, and my apologies for this kind of very rough diagram here. This is the like hand-drawn style doodle here. But we had residential students, off-campus students, faculty and staff, and the community at large. And the idea is that basically the connections are probably the strongest amongst the student population, and then weaker between the students and the rest of these other populations. And so, the other sort of piece of this, so there's a lot of uncertainty, as I mentioned, we didn't have a lot of data at the beginning, and even if you do, there's still a lot of uncertainty. And so what we did to sort of explore that uncertainty was we sampled across a wide range of different parameter values. So we explored different connectivity levels between those population groups. We also, in part of the dialogue around this model, as we were kind of working with it and seeing what needed to happen and what was most realistic, shifted which community population we were thinking of as the community. We had started off with more of a sort of county level model, and then realized that actually, because of how people mix and where contacts are likely happening, we really should be focusing in on a more Ann Arbor population as our sort of target population that we're thinking about. So we were exploring the sort of parameter uncertainty. Oops, whoa, wow, sorry everybody. That was, it like zipped right through there. Okay, we were exploring the parameter uncertainty, but perhaps even bigger than the parameter uncertainty is actually the model structure uncertainty, right? So we spend a lot of time thinking about parameter uncertainty, but the model itself is also uncertain, right? And so I mentioned before how we explored sort of different model backbones. We also built 2 versions of the model, one that was a more compartmental model, and then one that was an agent-based sort of network style model, where we accounted for this sort of multi-layer network that is particularly important when you're thinking about the student dynamics. And so we had a multi-layer network where the students have friendships. So this is thinking about friends, party contacts, things like this, various people that they interact with in sort of overall general socializing, residence hall contacts, and then also class contacts for those who were in person, where we use the distribution data for in-person classes and how much contact there might be there, as we were expecting, at least for fall. And so this network structure is kind of important for thinking about how student the dynamics of transmission among students. And so that was sort of a key piece of a lot of the model development work that we were doing over the course of this. Okay, so that's the sort of base sort of range of models that we were looking at, and when I'm showing the results next, I'll be showing results from the sort of Ann Arbor community, where you have this tight coupling among students, and it'll be a mixture of the simulations from the compartmental and the agent-based network model that I'll be showing. Okay, so some quick results. So first, the residence hall, reducing residence hall density, I don't think it will surprise anyone to hear that reducing residence hall density, it does reduce cases, right? So that's sort of not unexpected, I think. But the kind of interesting thing, so we did some different projections around how residence hall occupancy might affect the sort of average cases per week. Our projections here ended up fairly close to what actually ended up happening for the fall. The actual cases per week, I think, average out to something like 170 cases per week. So it's within this sort of darker uncertainty region here that we had. And so now the one thing to note, though, is that that's kind of interesting. Oh, gosh dang it, sorry. That's kind of interesting is that I think like it's important to note that residence halls are really sort of only one facet of the response here. So, when we think about going to between fall and then to winter, when we had a much lower residence hall occupancy, that you reduce the cases per week that you would expect to see. And we did see, we have seen fewer cases this semester than in fall. But, the uncertainty range across the parameter space for all of these, it gets lower as you reduce residence hall occupancy, but it's pretty wide, right? And that's a reflection of the sort of lack of data that we had. And so, I think part of the reason that you have this sort of wide range of uncertainty is because there are other features that are also impacting transmission, right? And so some of those are, for instance, off-campus patterns of behavior and community patterns of behavior. And so I think that's something that we've kind of seen in this winter semester, is that even though residence hall density has been reduced a lot, off-campus and community patterns of behavior can still lead to surges, as we've seen, and different potential for increases. And so that's something to kind of keep in mind. So we also looked at how roommates and not having roommates affects transmission and all of these different kinds of things. But I just sort of wanted to kind of mention this, and just to kind of underscore, this winter semester has shown that even when you reduce residence hall density, you might still within a region see increases, whether that's, some of that perhaps from This was a headline that was out in February at one point, but then also some of it just from community transmission. The current surge that we just are starting to see a decline on, didn't have such an increase among the cases, but really was kind of community driven. So there's lots of different residence hall density is not the only thing, and I think that's reflected in the high uncertainty here. Okay. The other thing that I wanted to sort of talk about is testing, and so this has been a pretty major discussion point over the course of this last year, and we did a lot of simulations of different testing approaches and different possible kind of ways to structure testing, and what we ended up really finding across all of these different simulations and scenarios was that the real key to effective testing is to get infectious individuals from onset to isolation as fast as possible, which again is not, that's not necessarily a surprise, right? But it's something that I think is important to kind of, dang it, I'm sorry, everybody. There we go. Something that is important to kind of underscore, because what we ended up finding with the model is that it really is all about getting sort of better basics, getting infectious individuals from their moment of onset to isolation as quick as you can. And I think that really underscores why sort of the fact that it's not just how many tests are you running, it's really the whole chain, right? So because reducing that time from onset to isolation depends not just on sort of how many tests do you have or how many tests are you running, but it depends on student engagement. It depends on, those testing resources themselves, contact tracing, case investigation, quarantine and isolation resources, to really reduce that time from onset to isolation. There's a whole sort of chain. And I think I stole this slide from Emily, but basically to get from that onset to isolation, you have to test positive. There's a whole case investigation process, contact tracing, et cetera, that gets people from like the first detection to quarantining their contacts and isolating the person. And so, there's a lot that needs to happen. And so I think the model kind of helped underscore the importance of that whole chain in terms of a testing strategy. And the last thing that I'll mention when it comes to sort of the testing piece of this is that the sort of like the sort of surveillance testing approach was another kind of big thing that was discussed, and we've explored different surveillance testing levels. This simulation was done at a time when surveillance testing was quite a bit lower than it has since grown to become, and looked at how infections can be prevented by surveillance testing, and you can get some pretty strong infection counts of infections averted as you increase surveillance tests per week. But what we did find is that it's really critical to have that surveillance testing on top of the sort of foundation of fast, effective symptomatic testing. And so the other thing that's interesting when it comes to modeling surveillance testing is that, of course, if you're modeling case, sort of the detection of cases and reporting, then as you model increased surveillance testing, you can see this thing where because you're testing more, you detect more cases. But if you look at the actual underlying infections that were averted by doing increased testing, you can really see that the infections prevented get pretty strong. So that was sort of two kind of vignettes of kind of how these campus models can be useful. The last thing I wanted to talk a little bit about was sort of herd immunity and fall 2021 planning. And with this audience, and also just given the like it's COVID, everyone has heard all the things now about herd immunity, et cetera. We probably don't need to explain herd immunity, but sort of this herd immunity threshold is this idea that if there are more people than a certain threshold who are immune, then the number of new infections will tend to decline. Right now, this depends a lot on a lot of different factors, and so I wanted to kind of talk about some of the modeling that we've been thinking about when it comes to this coming fall, and thinking about the trajectories for our community in terms of vaccine coverage. And here I wanted to kind of highlight that often what's needed for decision making, and I found this in a lot of different circumstances, is not necessarily really highly complex models, but even just what if scenarios for exploring different possibilities, even if it's not sort of the fanciest model out there, or the sort of like, even if it has some assumptions or problems or whatever, just using sort of simple scenarios as a way of kind of thinking through the what ifs is often a really kind of useful exercise. And so I thought I'd talk about this a little bit when it comes to herd immunity. So, there's this classic equation that's based on R naught for the herd immunity threshold. But this sort of seems simple initially, but then as you have to sort of then account for more and more factors, it ends up being that even kind of coming up with these what if scenarios requires a little bit of thinking and a little bit of care, right? And so the herd immunity threshold is sort of the classic, is just based on R naught, but if you account for the eligibility of the population, that only over 16 or maybe soon over 12, individuals can be vaccinated, vaccine effectiveness, variants, contact networks, et cetera, these even sort of simple what if scenarios end up being a bit complicated in their way. And so I wanted to kind of talk through that a little bit with this sort of herd immunity threshold, sort of thinking through what levels of vaccine coverage might we need. So if we, for instance, suppose that our R naught is around 2.5, which a lot of the sort of estimates of the early RT in Michigan were around 2.5-ish. And so let's say that's the underlying R naught for COVID in Michigan. That would get you a herd immunity threshold of, let's say, 60%. But then if you account for vaccine effectiveness, which let's suppose is a mix of who's getting first doses versus second doses, J&J, Pfizer, and Moderna, let's say a vaccine effectiveness of around 90%, then that gets us to a herd immunity threshold of 67. Once you account for the fact that if you're only going to be able to vaccinate among the 16 plus population, then you need 81% coverage among 16 plus to get to the herd immunity threshold for the whole population. And then if you account for the fact that there's widespread variance now among the population, that gets you up to sort of a really high potential herd immunity threshold. That it means you basically need to vaccinate everybody across the whole 16 plus population. Now, that sounds dire and unlikely to be possible, but there's also a ton of other factors too, right? So the social contact structure is also important. Whether you have other mitigation measures in place is also important. You know, the classic herd immunity threshold doesn't account for other mitigation measures still being in place. And so, you know, a lot of the kind of thinking through this is sort of thinking about, well, what if this, what if that? And then, you know, kind of even just thinking of sort of these back of the envelope calculations to get a sense of kind of where might we stand. So, you know, for instance, if you wanted to think about the sort of social contact structure, you could think, okay, well, there's sort of two extremes here, right? One is that our sort of student population is mixing completely with the rest of the community, which we know is probably not true. But if that was the case, then that's where you get to these sort of 81%, darn it, I'm sorry, 81% and 99% thresholds that we saw just a moment ago for non-variant and variant COVID. But if you take the sort of opposite extreme and think of the student population as being a bubble, essentially entirely separate from faculty, staff, the community, and anyone under 16, then you get these sort of different herd immunity thresholds for non-variant and variant COVID. So, you know, these are very rough and they have a lot of assumptions, which are sometimes perhaps problematic, but they let you kind of do a little bit of back of the envelope thinking of, you know, what might you see under different circumstances, what kinds of targets might you need to hit for different kinds of purposes. And then, of course, we did do some modeling of how vaccine coverage rates would affect transmission in the campus population. And, you know, what we end up finding is that even if herd immunity, if it's not possible to reach the sort of herd immunity threshold, vaccination can still prevent a lot of cases. And so if you look at the percent of cases that are prevented, even if you're sort of not really near the herd immunity threshold yet, you know, there's a wide range, you know, for some parts of the parameter space, it maybe doesn't prevent that many cases, but for others it can. And so, you know, there's kind of this, there's a possibility to have impact with vaccination, even if you know, you don't reach the sort of technical herd immunity threshold. And so I think that's important to note too. So let's see, I think I'm running out of time. The last thing I'll just mention is that, you know, part of the planning process, I think, is also just thinking through, you know, how might, like there's a lot of human behavior questions that don't have, you know, that are related to transmission, but are also kind of their own thing about how many people do we think might get, you know, how many early adopters have we already seen get vaccinated, and as we move into this kind of realm where we're thinking more about hesitancy and convenience, and how do we encourage people to get vaccinated, you know, I think sometimes it's useful to be able to just sort of explore scenarios by playing around with them. And so we made this little shiny app that lets you sort of tool around with, you know, how many first doses per week do we anticipate seeing in Michigan? And you can choose any MERC region or county. So you can play with Washtenaw and see, you know, how many doses per week do we expect to see? You can see the data and the age breakdown here. And then what does that mean in terms of first dose coverage for 16 and over? And so, sometimes just sort of simple explorables and things like this are often also useful, even though the underlying model here is extremely simple. But, it's just a way to kind of let you play with the numbers and do some back of the envelope stuff. So anyhow, just to wrap up, so I think I hope that I've kind of communicated the importance of exploring different model structures and parameter space, particularly when you're working with relatively little data. I think we've heard this many times today, that speed is important for relevance. And so it's important to kind of to make that possible. Keeping it simple when you can is good, but then there's this challenge, right, of making sure that you balance sort of speed and rigor and making sure that you cover your bases. And I think the other thing to maybe mention is that uncertainty can be informative even if it's large. It at least gives you ranges that you have to plan for, right? So even if you can't say it's going to be here or it's going to be here, this at least tells you something that, well, I better plan for in case it's here, just in case. So like I think that can be useful even when the uncertainty bars are very large. And so I think with that, maybe I'll wrap up because I think I'm running out of time. I'll just say thank you to my team. Again, such an amazing group of people, all the collaborators and folks that I've been working with. And yeah, thank you. I don't know if there are questions.
Excellent. So you are running out of time, so I'm going to give you an assignment and send you to the question and answer forum. And excellent. You have a great discussion going on in there and questions waiting for you there. I think, some of the questions kind of speak to, if you wanted to give just a 2-second thought and feedback about how, when you're modeling, there were questions about behavior changes, for instance, mask use changes moving forward in time. And how do you think about that when you're trying to build models and sort of talk about different scenarios?
Yeah, this is a great question. Okay, so I'll give the world's teeniest answer very briefly. So the way that we've been modeling it is we've been making different assumptions. So for instance, when I showed those vaccine modeling projections, we assumed less mask use. We used a range and we sampled across a range, assuming less mask use and less social distancing than we had seen from the data from the model fits and things like that for fall and winter. So we sort of assume that there would be some opening up, but we don't know, right? And so I think this is kind of a key thing, is that for a lot of these human behavior pieces, because it's hard to model human behavior and it's hard to know what's going to happen, what you end up sort of having to do is say, well, if it's this scenario, here's what you would expect to see. If it's this scenario, here's what you'd expect to see. So rather than a blanket forecast, what you end up with is like forecasts that are kind of tailored for, if you start to see this kind of behavior, you're over here. If you start to see this kind of behavior, you're over here. So anyway, I'll wrap it up with that.
Excellent. Thank you very much, Marisa.